Hello, friends. Welcome to the new episode of our series on diabetes and low carb. I'm your host, Dr. Jasmeet, a certified low carb advisor. So, the today's topic of our discussion is PCOS, which is polycystic ovarian syndrome. PCOS is actually considered as an hormonal imbalance in women at a childbearing age. It's actually a hormonal imbalance which occurs at a reproductive age. Due to which, what has happened is nowadays PCOS has become the leading cause of infertility in women. And if we look at its rate, the prevalence of PCOS in India ranges between around 8% to 22%, depending on the criteria they have used for the diagnosis. And if we see, it's a huge number. Due to which, what has happened is people are now considering PCOS as an optimum state of human biology. But is it really a normal state of our body? No. It's an abnormal state of our body. So one must ask the questions to themselves why there is a sudden rise in PCOS, why there is a sudden rise in infertility in women nowadays. So they must ask questions like, is it our lifestyle that is causing it? Is it our diet? Is it the stress level we are having nowadays? Is it our sedentary or the modern lifestyle that is causing it? So all such questions people have to ask so that they can get some answer, because you deserve to get the right answers for what you are suffering from. So that's why we are here today to answer all your questions, to clear all the doubts related with this complex disorder PCOS. So for that, today I welcome the experts from the life, Anup Singh, Shashikant Iyengar, and Arun Kumar. So welcome all of you to your show.
Thank you. Thank you, Jaspreet.
So I think before we get to the the queries regarding this from the women that I contact with. So first of all, let me tell you briefly the symptoms that people are having. So the main symptoms, they are all related with the reproductive issues, like they have irregular menstrual cycles, and there are like some people have 8 to 9 cycles in a year, or some even have like heavy periods. So what happens is these all reproductive issues lead the woman towards a gynecologist. So they consider this issue PCOS as a gynecological issue. So some of you might think that if it is a gynecological issue, why we have included this topic in our series on diabetes and low carb? Because here we are more focused on the metabolic disorders. Like in our previous episodes, we have covered the metabolic disorders like obesity, diabetes, non-alcoholic fatty liver disease. But you will be surprised to know that PCOS is also one of the branch of the same tree. And all of these metabolic disorders, they are connected to the trunk, which is insulin. It is the insulin resistance which causes the higher level of insulin in your blood, and which actually are causing the imbalance in the six hormones like estrogen, testosterone in women. So with this, I would like Shashikant Iyengar to please answer the question, is it really a gynecological issue?
Yeah, Jasmeet, while all the symptoms per se shows that it's a gynecological issue, yes, it is. But if you see the root cause, when we see the root cause is something else. All along, this root cause was not at all identified, but of late, every major the associations or the medical associations, they have actually recognized what is the root cause. And some of the root causes which are really given, if you go and study the Mayo Clinic website, they have the four things which they're given is excess insulin, low grade inflammation, heredity, and excess androgen. Now, if you really analyze everything, the basic, again, among all this, the basic thing which will come is excess insulin or hyperinsulinemia or insulin resistance. And if you see this very state of hyperinsulinemia, insulin resistance itself will give rise to inflammation. Plus, there are various other factors which will give rise to inflammation, like we are having the wrong kind of food. The other thing is heredity. Yeah, there are some people who are little prone to PCOS. Now, if we take, let us say, 100 females, so there is a possibility that if hundreds of female they have the same kind of food, there are possibility that out of that 8, 9, 10, or maybe 15, 20 will have, others may not have. That is again because of genetically prone. But then there's a trigger, and the
Yeah.
trigger is the wrong kind of food we have. And the other thing is they say excess androgen. But if you really see, why does excess androgen comes into secretion? It is because of insulin resistance again. Hyperinsulinemia itself is going to cause release of excess androgen, and which is really proven, and there are tons of references in PubMed. So even if you take this one single website, that is Mayo Clinic, that itself will show it shows insulin resistance or excess insulin as the prime cause of PCOS. Yeah. So in effect, we can say that more than a gynecological issue, it's a metabolic syndrome, and probably anyone who is addressing metabolic syndrome can actually address this issue. Yeah. Over to you.
Yes, you're right. Actually, you mean to say that it's hereditary, no doubt. But as you tell that somebody has to give a trigger. If you don't, trigger, your genes will, they remain silent. You have to switch on. You have to give some trigger so that they switch on. But as you have correlated it with the insulin, which is a metabolic hormone, so it means it's more of a metabolic disorder than a gynecological issue. Basically, as you mentioned about the imbalance of hormones, estrogen and testosterone, which is a male hormone. These two hormones, testosterone and estrogen, it is present in both in males and female, but the ratio is different. In females, what happens is there is more estrogen than testosterone. And when a person has an unhealthy lifestyle, their insulin levels increase. As we have already mentioned in our previous episodes, how insulin plays a role in our metabolic flexibility. So when there is a high insulin, due to the insulin resistance, the precursor of estrogen is testosterone. And what happens is there is something that converts that testosterone to estrogen. But when there is a high insulin, that insulin inhibits this translation from testosterone to estrogen. Thus, in women, what happens is their estrogen level drops. But that estrogen has to be increased at some time to for a woman to ovulate at the right time. There should be a surge. Actually, it's not that estrogen, we just can't go for a test of estrogen at any time. There should be a surge in estrogen at right time and with the right amount. So this is the reason. So you're right that it's a metabolic disorder because insulin is connected, and insulin plays a huge role in converting the testosterone to estrogen. When there is a high insulin, this conversion is inhibited and there is no estrogen when it is required. So a woman can't ovulate. So that's why the women miss their periods. So Arun Kumar, with this, I think you should mention the other symptoms related with PCOS, because we have already discussed now about the irregular menstrual cycle. But as we have mentioned, the imbalance in hormones, estrogen to testosterone in women, what are the other symptoms women start to see?
Look, Dr. Jasmeet, actually there are several symptoms, but if 2 or 3 symptoms doctor notice that this is there, so they can diagnose it as a PCOS. The first, as you told, that it is either oligomenorrhea, means lack of menstruation, or the missed periods, or say hemorrhage, means heavy menstruation. So that is the one side symptoms. Next is if there is a cyst present in the ovary. Minimum 12 cysts is considered by the doctors, that if 12 cysts are there, then it can be diagnosed as a PCOS. But it is also mentioned that it is not necessary that all the cases of PCOS, they should have cysts present. Maybe some women have the normal number of cysts in their ovary, but still she is having PCOS due to the other symptom. Then the other symptoms with the physical examination, you can say the hair on face, hair on the body, and thinning of hair of scalp. That is due to the high level of androgen. If there is a high level of androgen in the serum, then thinning of the hair and the scalp will be there. So that is the symptoms you can notice. Then if you go for the blood test, you will find the higher level of androgen and higher level of insulin level. Because insulin, as you mentioned, insulin is the hormone which actually inhibits the conversion from androgen or testosterone from to estrogen. So if insulin is very high, this inhibits the conversion to estrogen, and we know that estrogen is required for ovulation, say somewhere in between 12 to 20 days or 24 days. In between, the estrogen level will be high so that the ovulation will take place. But if that estrogen level is not high, so ovulation will not take place. That is the one point. Then other symptoms, as I mentioned you, that hair and this menstrual cycle, as well as some other symptoms may appear, that's masculation in the masculinization of the woman. There is a hair on the face, hair on the cheek, hair on the hair body, hair on the chest and all. So this is called the hirsutism. So if these symptoms are available, these symptoms are there, so doctor can go for the test, for the blood test and the CT scan or the, say, ultrasonography to finally confirm that this is a PCOS. Dr. Jasmine, am I clear?
Yes, yes. So it's a high level of testosterone that causes the thinning of hair. Where the women don't want hair, it appears, and where they really want, it start to thin out.
Yes.
So my next question will be to Anup. So Anup, we already discussed now about insulin. So like, when a woman start to see such symptoms that we have already discussed, like facial hair growth and like irregular cycles, when they go to gynecologists, they do test like the other hormones which are related to these two main hormones, estrogen and androgens. They go for, even they test LH, the stimulating hormones like follicles, FSH, the follicle stimulating hormones. They do go for the tests like estrogens and androgens. But do you think that the doctor ever go for insulin test, because which is the main driver of all these hormones? Because अगर आपका ड्राइवर ठीक होगा तो आपके जो बाकी पैसेंजर हैं वो अपने आप नॉर्मल हो जाएंगे. बट डू यू थिंक कि डॉक्टर कभी भी इस ड्राइविंग फोर्स को टेस्ट करता है, इंसुलिन को टेस्ट करता है जो आपके बाकी हार्मोन्स को ड्राइव कर रहा है?
99% answer is no. And why don't they test? वो आई थिंक किसी एक एपिसोड में हम लोगों ने डिस्कस भी किया था कि अगर इंसुलिन हाई है भी तो वो करेंगे क्या उस नंबर का, क्योंकि देयर इज नो पेटेंटेड पिल और एनी इंजेक्टेबल विच दे कैन गिव जिससे वो लेवल डाउन कर ले. ठीक है, तो जैसा शशि ने भी कहा था, दे आर जस्ट ट्रेन टू,
वो इंजेक्शन देके कम नहीं कर सकते ना.
हाँ, वो जैसा शशि ने किसी एपिसोड में बोला था कि दे आर ट्रेन टू डायग्नोस एंड दे आर ट्रेन टू प्रिस्क्राइब मेडिसिन. डायग्नोसिस ठीक है कर लिया, बट मेडिसिन है नहीं. जब मेडिसिन है नहीं तो वो टेस्ट क्यों करेंगे? किसी का मान लीजिए आ गया 35, फास्टिंग इंसुलिन इज 35, नाउ व्हाट डू दे डू विद दैट नंबर?
नथिंग,
कुछ नहीं. सो दैट इज व्हाई दे नेवर टेस्ट. और I would say it is more driven by commercial interest. जिसकी medicines हैं वो सबसे they will stress on those tests. जिसकी नहीं है तो they will ignore it. And that is why low carb या आप बोलो to reduce insulin through lifestyle changes, उसका भी उनको कोई knowledge है नहीं. Again Shashi had said nutrition knowledge they have zero. तो ये है अनफॉर्चुनेटली.
तो इसीलिए कि क्या हो रहा है कि हाँ, जब भी किसी को ऐसे सिम्टम दिखते हैं, दे डायरेक्टली गो टू द डॉक्टर एंड द डॉक्टर स्टार्ट टू प्रिस्क्राइब द हार्मोन्स, दे स्टार्ट हार्मोन थेरेपी. तो
या जैसे छोटी सी चीज है, देयर फोकस इज हाउ टू सेल मेडिसिन. दैट इज द प्राइमरी फोकस. वो आप HRT बोलो या एनी पिल which can keep the patient busy for life with them. छोटी सी चीज है, hidden PCOS. Vegetarians face it because of zinc deficiency. ठीक है, कई लोग जो ये शुगर फ्री से एडिक्टेड है, artificial sweeteners, even
Yeah.
that is a cause. Even that is a cause.
Okay.
Will a doctor ever recommend to go off it? No. क्योंकि न्यूट्रिशन और ये सब का उनको पता नहीं है. ये है.
नहीं, Anubha's raised a valid point that these artificial sweeteners may be endocrine disruptor. So may they disrupt your endocrine system, and the release of hormone is influenced by these. So better not to take the artificial sweeteners like whatever sucralose and aspartame and all. So that is also because there are the environmental factor also which disrupt your endocrine system. So in that case also you will be victim of the PCOS.
I think it's an environmental factor also.
और एक चीज है, will they ever test vitamin D? No. ठीक है, और 99% of the studies, basically what I say normally is anything which cannot get money to Rockefeller gangsters will never be popularized. ठीक है, विटामिन डी के आप देखोगे स्टडीज जो है ना, जो FDA के थ्रू रूट होते हैं ना, they will always talk against विटामिन डी. वो कभी नहीं सारे सप्लीमेंट्स के पीछे पड़ते हैं, मैग्नीशियम इज यूजलेस, विटामिन डी इज यूजलेस. What is useful is whichever drug is patented, that has to sell.
Yeah, Jasmeet, the same question. Let me also put in certain views.
Yeah, okay.
I have seen one or two gynecologists. They recommend doing fasting insulin test.
Okay.
So it is very rare, and I felt that the person is really intelligent enough to do fasting insulin test. So now some may be doing it. Now here there are two issues. When you do fasting insulin test, let us say if it comes to 15 or 20, there will be no action. Why? Because the normal fasting insulin which is given is between 1 and 25. And we know that a level of 25 is just atrocious. I mean, we recommend a fasting insulin of either 6 or below. So anything above that can indicate a progress into hyperinsulinemia. So if someone is showing 15 and the lab report shows the top end is 25, there is going to be no action at all. And it is not going to be recognized. It is so unfortunate. One. Secondly, ideally, they should be doing what is called as insulin resistance test or measure the HOMA-IR. If they do HOMA-IR, they will know. But unfortunately, this is not done. They should be measuring their fasting insulin, fasting blood glucose, punch into a HOMA-IR calculator, and then immediately they will know. If it is about 2, then it is insulin resistant state. But I can assure you that no one does this. Probably they measure fasting insulin and just show.
Yeah, even nowadays the women might have fasting insulin that ranges between 5 to 8 also, and then they consider it a normal value. But if we go for the oral glucose tolerance test, I have seen one patient whose fasting insulin was around 7 to 8. So she considered it a normal. Even if according to us, I know that there is an insulin resistance already existing in her body. But when we go for the 1 hour, 2 hour test, the 1 hour was 78 and the 2 hour was 120. Can you imagine? So there is a huge insulin resistance and there is load on the pancreas.
And the other point is, anyway, since now the latest guidelines, everything shows that it's an insulin resistant state. So the best thing they do, the drug which will address this to some extent is metformin. So invariably, all the patients are put on metformin. So this is the present state, how it works. Yeah, Jasmeet.
So that's why I think the PCOS, we should consider it as a pre-diabetic or a diabetic. Is similar to a diabetic condition. There is no difference between diabetes and this PCOS.
I think net here, fasting insulin has to be done and fasting blood sugar has to be done, and then do a HOMA-IR. Parallelly, they should also be seeing the level of triglycerides upon HDL ratio. This will again indicate insulin resistance. So if these 4 or 5 or 6 things are done, only then they can arrive at a total real conclusion that the base causes insulin resistance and take action. Yeah,
yes.
I just.
So you think that whenever a woman suffers from any such kind of symptom, they should first go for the fasting insulin. They should go for their complete lipid profile, as you mentioned, like triglyceride and HDL. ratios. And what else you mentioned?
And then the standard tests which are being done, the androgen level and all,
Yeah.
testosterone level which is being done. So the routine test has to be done, of course, but this is an addition which I think that should be done: fasting insulin, fasting blood sugar to determine HOMA-IR, and then a lipid panel test to see the level of triglyceride and HDL, because triglyceride HDL ratio will again show that it's insulin resistant state. Anything above 2 is insulin resistant state. Yeah,
Okay.
over to you.
They should consider if their triglyceride to HDL ratio is above 2, they should consider them as an insulin resistant person, and there must be high insulin going on in their blood, which is causing this hormonal imbalance. Okay. So another thing is, Arun Kumar, like we mentioned that the first prescription given by the doctor to such women is always a hormone therapy. Even in the pre-menstrual syndrome, like the women, they have pains like 10 to 12 days before they get their cycle, their periods. Like in that case also, even in perimenopause also, and even in this PCOS case also, the doctor prescribed them with a combination of hormone therapy in the form of birth control pills. And even the women, they start to see some get some relief from all these symptoms, but they have to take it for the long term. But do you think that it is really safe to take all these estrogen combinations for the long term, and are they really helping them?
Dr. Jasmine, first thing that if doctor is prescribing contraceptive pills or hormonal pills which contains hormones, progesterone and estrogen, so that is for those women who don't want to conceive. First thing. Second thing, that long-term use of this estrogen and progesterone is linked with many of the other problems, which cancer is one of them.
Yeah.
So in that case, if woman is choosing to have this contraceptive pills, then she has to pay the price heavier. This is first. Second one, that this is the right solution, because you are treating just suppose I can give the example कि हम पेड़ के पत्तों को पानी दे रहे हैं, मतलब instead of giving to the root, तो पत्तों को पानी देने से तो पेड़ ठीक नहीं होगा ना, हमें तो रूट कॉज देखना पड़ेगा ना. तो रूट कॉज हमने डिस्कस किया कि इट्स इंसुलिन रेसिस्टेंस, तो हम उसको तो ठीक कर नहीं कर रहे हैं. हम डॉक्टर क्या करता है, देखिए एक टेंडेंसी है कि जब इस तरह का प्रॉब्लम आता है, मेंस्ट्रुअल साइकिल इरेगुलर हो जाते हैं या कंसीव नहीं हो पा रही है एक लेडी, तो सी यूजुअली गो टू गायनेकोलॉजिस्ट. जो भी उसका गायनेकोलॉजिस्ट है उसके पास वो जाती है, और गायनेकोलॉजिस्ट क्या है, सिंपली उसको बहुत इजी प्रिस्क्रिप्शन है कि ओरल कॉन्ट्रासेप्टिव पिल्स दे दो जिसमें कि एस्ट्रोजन भी है, प्रोजेस्टेरोन भी है, तो उसका सिम्टम्स खत्म हो जाएगा, मेंसेज उसका रेगुलर हो जाएगा. लेकिन जब भी 8 महीने 2 साल 4 साल के बाद शी वांट टू गेट कंसीव, I have read some reports that long-term use of contraceptive pills also leads to the PCOS. तो फिर से दोबारा उसी साइकिल में पड़ेगी. ये हो गया. दूसरा क्या है कि जब वो कंसीव करने के लिए आपको बनाना है, वो अगर कंसीव होना चाहती है, she want to carry the baby, in that case this is not the solution. Best solution that you treat her the root cause, that is insulin resistance, and to some extent the anti-androgenic drugs which are there. So you can treat this. Otherwise, I have seen some doctors, तो ठीक है, फेस पे हेयर आ गया तो तुम ये मेडिसिन ले लो, तुम्हारा ये प्रॉब्लम है, या तुम्हारा बॉल हो रही है तो ये ऑयल लगा लो. तो these are just आई वॉश, these are not a treatment. तो गायनेकोलॉजिस्ट के पास जाने से तो गायनेकोलॉजिस्ट तो वही लिखेगी जो उसको मालूम है. वो सिंपल चीज है, वो कॉन्ट्रासेप्टिव पिल्स देगी, बट दैट इज नॉट द सॉल्यूशन. Solution is to reduce her insulin resistance so that the right amount of estrogen will be released at the right time for ovulation. Otherwise, ovulation will be continue. तो ओवुलेशन के लिए हमको एस्ट्रोजन चाहिए, वो भी राइट टाइम पे, एज यू मेंशन अर्लियर, और राइट क्वांटिटी में. वो तभी बनेगा जब आपका इंसुलिन, ब्लड इंसुलिन जो है ना, वो नीचे रहेगा, वो लेवल उसका नीचे आएगा. जब तक हाइपर इंसुलिनिया रहेगा तब तक तो वो कन्वर्ट होने से रहा, बिकॉज इट इज नोन फैक्ट कि वही इंसुलिन है वो आपको एंड्रोजन को या टेस्टोस्टेरोन को वो आपको कन्वर्ट करता है एस्ट्रोजन को. तो वो एंड्रोजन को कन्वर्ट ही नहीं कर पाएगा, हाई लेवल रहेगा इंसुलिन का, तो एस्ट्रोजन बनेगा कहाँ से. तो सिंपली यू गो फॉर द सिंपल थिंग, You treat the root cause, reduce the insulin resistance, and then things will be okay. So prescribing medicine, oral contraceptive pill is not the remedy, but rather it will land that woman in some other problem. I have seen many of the women who are continuously taking the oral contraceptive pill and they have some other problems. I have seen the excessive hormones causing the different problem in the body. Even this obesity is one of them. The male voice has come. So these are the problems. If women want to avoid, then oral contraceptive is not the right solution. But maybe for the time being, our period will be regularized, but that is not the solution. Okay, doctor.
यस अरुण कुमार, आपने बहुत अच्छी बात की है कि हाँ, अगर आप डॉक्टर के पास जाओगे वो तो आपको वही बताएगा जो उसका काम है, ठीक है. इफ यू गो टू गायनोकोलॉजिस्ट, ऑफ कोर्स शी विल नेवर लुक इनटू योर इंसुलिन, योर मेटाबॉलिक डिसऑर्डर, ठीक है. तो क्या होता है कि हमें अपनी जब भी कोई इश्यू होता है तो इंसान को पहले खुद से क्वेश्चन पुट करने चाहिए कि हाँ, ऐसा उसकी बॉडी में क्यों हो रहा है, व्हाई देयर इज सच इम्बैलेंस क्रिएटेड इन देयर बॉडी. वी शुड लुक एट द होल पिक्चर बिकॉज ऑल द हार्मोन्स दीज आर ऑल इंटर रिलेटेड. ऐसा नहीं है कि हाँ, आपने कोई एक बीमारी तो इसके लिए ये पिल ले लो, ये वाला पिल ले लो, इसके लिए अलग पिल ले लो. बट अनटिल अनलेस, जैसे आपने बोला कि हाँ, पत्तों को पानी देते रहेंगे तो कभी भी जो आपका है ना पेड़ कभी भी ग्रो नहीं करेगा. सो अगर आप चाहते हैं कि आपका पेड़ हरा भरा रहे तो आपको पहले रूट कॉज, अपने मिट्टी को पानी देना पड़ेगा वहां पे. सो थैंक यू सो मच.
एक पॉइंट और हम मिस कर गए. मिस्टर अनूप has just told that vitamin D is very important. But I read that when there is a PCOS, there is a connection between the hypothalamus, pituitary gland, and ovary. So this connection will put in place with vitamin D. अगर विटामिन डी बॉडी में कम है तो ये भी डिस्टर्ब करता है ओवरियन फंक्शन को और उसके चलते सिस्ट हो सकता है. सो दैट आई हैव जस्ट वांटेड टू ऐड. थैंक यू.
सो शशि जी, जैसे आजकल आईवीएफ ट्रीटमेंट तो इंडिया में भी बहुत पॉपुलर हो चुका है ना, तो पीसीओएस के पेशेंट भी मैंने देखा कि इसका भी बहुत रेट है आईवीएफ ट्रीटमेंट की तरफ जाने का. तो आपको क्या लगता है कि अगर आप कोई भी पीसीओएस पेशेंट है तो वो आईवीएफ ट्रीटमेंट करवाता है, ठीक है, तो उससे क्या उनका ये वाला प्रॉब्लम इनफर्टिलिटी इशू, क्या कंसीव करने का इशू रिजॉल्व हो जाता है इससे?
What has happened is the base, the function, okay, that doesn't improve. So that the root cause always remains. So this is just a palliative method in the sense something is done and then the female has child, maybe through IVF, it doesn't matter. So ho jata hai isme. So you give various hormones and then give estrogen, progesterone, suppress the androgens to some extent, but root cause is never addressed. So isme ho jata hai, but then the basic cause remains. So it is going to keep causing an issue lifelong. So we see sometimes, okay, people do address this issue when they want to have a child, but what about later on? Later on also, this still remains abnormal bleeding, or let us say no periods at all for quite some time. All these issues will remain, obesity, plus all the associated things. So while these are just, we are just solving one immediate issue, but then the basic issue remains, which is never addressed. So the sooner we realize this, the better. So it is really sad that a patient has to go for if a patient is suffering from PCOS and is going for IVF. So though I am sorry to say that it is a really sad situation. Because something that can be just addressed with the right kind of methodology of treatment. I have to undergo a lot of things, a lot of hormone therapy, spend a lot of money, time, agony, everything goes.
Also, I know.
So something where the remedy lies somewhere, we are just barking at the wrong tree, unfortunately.
हाँ, तो मेन एक्चुअली प्रॉब्लम यही है ना कि लोग हर कोई आसान तरीका ढूंढता है.
People do not know. See, let me tell you two things.
Even if they know, like even in our case, like we treat so many diabetic patients.
That's a different thing. See, this is different, Jasmeet. When it comes to child, people will do anything, let me tell you. But unfortunately, people do not have knowledge. Right. People do not have knowledge, and then they will go. It is. They are also right in their own point. They will go as per the medical treatment which is there, absolutely. But they do not know.
Is important in women.
Yeah, they do not know that such option is available. So once we get into this option, I'll come out with some surprising thing which many of us may not know this. So we'll come to that later on. Yeah.
Anup Singh, what are the other medications you think that the doctor prescribe other than this hormone therapy?
Primarily medicine for diabetes, and that too metformin only or its cousins.
So somehow कि doctors को पता है कि हाँ कहीं ना कहीं कुछ है ऐसा, but
Yes.
they never tell the patient.
Yes.
वो medicine जरूर prescribe करते हैं diabetes से related.
Yeah.
Yeah.
I mean, that
So
is the first thing they do, and that is the last thing they do as far as tackling the insulin resistance जो है ना, वो बस उसके आगे नहीं जाते वो.
So Anup Singh and Jasmeet, let me take up this question if you
Yeah,
don't
sure.
mind.
Yeah,
So
sure.
what they will do is, they will try to suppress one symptom which is there. So to regularize the menstrual symptom, they will prescribe contraceptives, oral contraceptives they will do. And then what is the other issue to how to ovulate? Then they prescribe other drugs. There are other drugs like say clomiphene or
Yeah.
gonadotropins. They recommend that, along with of course metformin, the usual thing. And what to do for this hirsutism, this excessive hair growth? Again, birth control pills. And then there are certain other drugs like even spironolactone, which
Yeah.
are actually used to suppress this growth. So what is happening is, in effect, we really see the suppression of symptom is something which is happening. So abnormal periods, they will regularize that, and then androgens, they will try to push it down, and then abnormal hair growth, that they will do various other treatments. They even do electrolysis and all to remove this excess hair growth. So if you really see, all this will only suppress the symptom. So the root cause is very, very rarely addressed.
Yeah, even I know few patients, when they come to me, I ask for the insulin, and when they go to doctor, they just give a bulk of medicines, and then they again come, they say like, you told so many things to change the lifestyle, don't eat this, and the doctor has solved all my issues by just giving the pills, and they're very happy,
So that only happens only temporarily. I mean, the basic issue still remains. They may have regularized the period for some time. They may have a childbirth. They may have taken care of the androgens. They may have taken care of the excessive hair growth, all for some time. But then the root cause remains, and it is going to explode today or tomorrow. So maybe it is going to explode in a different way also. Maybe they will get full-blown diabetes, and maybe they will develop hypertension because of the root cause insulin resistance is still there. So that's
why these PCOS women are always prone to these all other metabolic disorders, like even cardiovascular disease.
A lot of other things we will see, sleep apnea.
Yeah.
So
actually,
also part of it, obesity. Yeah.
I think 80% women having the PCOS are obese also.
Yes.
80%. But 20% are the lean, but 80% are obese. That itself indicates that if you're not treating the insulin resistance, then the things will turn another way. Hypertension, high blood glucose, and then cardiovascular disease, and so on, sleep apnea, and so. So you have to treat them. But I'm surprised to see that no doctor is treating the insulin resistance, nor he is advising his patient that go for the lifestyle change, have some physical exercise, change your food habit, reduce the carbon. No doctor is telling that. They prescribe this, as Sasi mentioned, they prescribe certain medication. Apart from metformin, they will prescribe clomiphene and all, but that is not the right treatment. Because even if she is having the child with IVF, then her body, the problem is remain the same. IVF will not treat her PCOS, neither treat the insulin resistance. So even if she opt for the IVF, then that problem will be remain the same, and that woman will has to face the consequences in later in life.
I think even babies would be impacted, right?
100%.
Because if you are carrying with an elevated insulin level, that is going to impact the baby also at birth and later on, even later on.
So though insulin is the main factor that we have considered for the PCOS, but I think that there is a stress. Stress is also one of the main, factor in this PCOS. Because I read few articles, they say like the raw material that body used to make estrogen and all these hormones is cholesterol. And even the cortisol hormone, which is released when a person is stressed, it also needs cholesterol. And I see that there is a strong competition in the body. When we have a chronic stress, there is a strong competition that the body should make estrogen or a cortisol hormone. So I think the stress level should also be considered. And I think Anup, you should mention a few cases that we have on day life, like how you account for all the other factors also other than insulin. Like, please share your experience with the PCOS person.
See, we have we have only one case of, but she was diabetic also.
Okay.
Very young age, 23 years old.
23 years old.
Yeah, yeah. She was diabetic with, I think, blood sugar of 350 or something, and was Pcos case also. And since, as Shashi says, we address root cause, right? So as soon as her diabetes numbers were in non-diabetic range due to change of lifestyle, her PCOS also was resolved.
So
Her
she
case
had
is,
cyst in her ovary.
sorry?
Even had cyst भी था क्या उनके ovaries
वो
में?
उतना तो उसने डिटेल में she did not reveal, but she said कि she had PCOS and she was diabetic, 350 blood sugar reading. प्रज्ञा चतुर्वेदी उसका है, front end पे success story with pic is also posted, where she has, in her own words, she has described everything.
Okay.
And the thing is, she is vegetarian. जो लोग बोलते हैं ना कि लो कार्ब वेजिटेरियन नहीं कर पाते, Chaturvedi means Brahmin, and she is strict vegetarian. She stays alone in Delhi, and she is a working girl. अब आप सोच लो, इतनी सारी चीजों के बावजूद, if she can manage low carb, so low carb is very easy, and that addresses, as Shashi and Arun sir said, you have to address the root cause. ठीक है? 70% or 80% of PCOS cases are because of insulin resistance. बाकी वो 20% में आपका taking pills, birth control pills could be one reason. Then वो hidden PCOS जो बोलते हैं वो है, and inflammation. Yes, after insulin then comes the inflammation. वो भी कोई टेस्ट नहीं करता है. Nobody tests except for HSCRP. वो टेस्ट करते हैं अगर बहुत ही extensive टेस्ट कर रहे हैं. But inflammatory markers is also one of the causes. अब उसमें फिर वही आ जाता है, magnesium is one, vitamin D is another. Now, how many doctors prescribe vitamin D and magnesium? Nil, almost nil.
Yeah.
So वही दिक्कत है. Whereas we vitamin D and magnesium, I think it has become a permanent recommendation for everyone who joins, because जो भी आता है वो आप मान के चलो उसका विटामिन डी लेवल 10 के नीचे ही रहता है. They are unaware. ठीक है? We start with vitamin D, we start with magnesium. बाकी जो है ashwagandha and all for stress control, to some level, bringing down cortisol levels. So
Yeah,
instead
there
of,
are things also we can consider to control the cortisol. Like we can add some exercise, meditation, and some breathing exercises also help with this.
yeah, एक है शायद inositol क्या बोलते हैं ना उसको, शायद inositol for insulin resistance.
Ketone is particularly for PCOS.
Yeah, that is given. वो लेते हैं लोग. कितना सक्सेस है कितना फेलियर है, we don't have any experience on that as far as data is concerned.
So, Jasmeet, so the initial conclusion, I will say, not conclusion, some of our discussion, what it leads to is, first of all, the root cause being insulin resistance. And to address this, of course, what we recommend is low carbohydrate diet, lchf or ketogenic range, depending upon the necessity. So low carbohydrate diet just does address this. And one point which I was mentioning earlier, if you really visit Mayo Clinic website, it is very, very clearly given that hyperinsulinemia or excess insulin is one of the causes of PCOS. They have also recommended low carbohydrate diet as an option for PCOS patients. It is very, very clearly given, and I can send the links. They are categorically mentioned low fat, high carbohydrate diet causes insulin resistance. And then the solution is a low carbohydrate, high fat diet. It is very clearly there in the website also. Unfortunately, how much of this is known, I really don't know. But you can just visit their website and see. So if a big body like Mayo Clinic can have these statements very categorically given that low fat, high carb diet leads to insulin resistance, and that high fat, low carbohydrate diet can be an option for PCOS patients. I think this is something which everyone should know, and this is something which can be addressed with just reducing the carbohydrate to a good extent, and no need for bombarding the patient with so many different pills to regularize lot of symptom. Instead of regularizing the symptom, you may as well address the root cause by cutting down the carbohydrate. Yeah. Over to you, Jasmine.
Yeah, okay. Thank you so much, Shashi. So I think you have already summarized our discussion, like we should first look into the root cause, which is the high insulin level. So the first option is always the low carbohydrate, high fat diet. And along with that, we should also add exercise and some supplements that can help with the stress level. And we can also add some meditation or some breathing exercises that can also help to control the cortisol level. So what other things that we would like to add, like is there any specific type of exercises that you would recommend for PCOS patients, or just like
Anup?
we already discussed in our previous episodes, like just the
I think
movement?
Anup can tell.
Actually, I read recently that 5 to 10% reduction in the body weight will resolve the PCOS. Means if you are reducing your body weight, means you are also reducing the insulin resistance. You know, obesity is linked with insulin resistance. So it is. I have some report I was there looking for that they are claiming that 5 to 10% reduction in body weight will reduce your PCOS. That body weight reduction can be done with the low carb diet and added with the physical activity. That maybe that is aerobic exercise, walking, running, or say sometimes similar like this. Or then if she can, she can do also resistance exercise. But the goal is to reduce the weight. I think Anup is more capable of answering this question.
Yeah, yes, Anup.
No, sir, I just keep it very short and empirical जो नाम की चीज होती है ना, I'm more of a empirical numbers या data पे चलते हैं. तो basically exercise का we had already discussed, I think in last episode ना.
Yeah, even in our obesity, we have discussed widely about
yes. So all the rules for obesity and exercise applies here also, because as Arun sir said, 80% of Pcos cases are obese. Now, definition of obesity can be anything. अगर किसी का 105 किलो वजन है, उसको तो हम बोलेंगे आप एक्सरसाइज करो ही मत, बिकॉज आप कुछ ना कुछ और डैमेज कर दोगे बॉडी में, या नी जाएगी, एंकल जाएगा, कुछ ना कुछ होगा. First, get your weight down through just diet change. When you are within 20-30% of your target weight, then you start walking. ठीक है, नहीं तो फिर क्या होगा, वो चलते चलते मतलब 105 किलो पे they will start walking. पहली गलती तो ये करेंगे. दूसरी गलती करेंगे, they will look for 6 kg per month weight loss. तो ये दोनों गलती तो कभी करना नहीं चाहिए. तो एक्सरसाइज का सेम रूल अप्लाई जो ओबेसिटी का है, सेम रूल अप्लाइज हियर आल्सो.
Because this sedentary lifestyle is also one of the major cause of insulin resistance.
मेरी लाइफस्टाइल पूरी सेडेंटरी है. Shashi is complete almost sedentary like me. 8 घंटे में कुर्सी पे बैठता हूँ, फिर भी कोई कुछ नहीं.
That you are sedentary, but you know that how to manage it. But if we talk about the general public, like especially the women, nowadays they are completely sedentary because the technology is available. They have all the comforts in their house. So this is also one of the major reason nowadays the women are suffering from this hormonal imbalance.
No, actually, I agree that Sasi and Anu, they are not going for any exercise. But that is not the truth. That is not the rule. I mean, if you see if you talk to women now, household women, तो मैं तो घर का सारा काम करती हूँ, ये
Yes,
करती हूँ,
that
ये
is
करती हूँ, तो but that is not the exercise. I mean, even if she is having the 105 kg weight, slow walking can be done. Start something. Physical activity should be started. If doing every day and routinely and with the low carb diet, weight is bound to reduce. I cannot accept that मेरा weight नहीं घटा, ये हो ही नहीं सकता। आप लो कार्ब पे जाएं और हल्का एक्सरसाइज करें, ठीक है, आपका वेट ज्यादा है, slowly you walk at the leisurely, say about 4-5 kilometer an hour, that is sufficient. And then when weight is reduced, then you can increase the exercise. But the first rule is go for the low carb. लो कार्ब में जाने से ही आपका वेट रिडक्शन होगा, जैसा कि शशि का है या अनूप का है, दे आर फॉलोइंग लो कार्ब, दे आर फॉलोइंग कीटो, सो दैट्स व्हाई they are not having insulin resistance, not obese. But this is not the rule applicable to everyone, particularly women who are genetically actually predisposed to certain fat accumulation in their body. अगर हम कहें तो वुमेन को ये जेनेटिकली है और ये सब सारे के सारे वुमेन को होता है, बट अगर वो फैट एक्सेसिव हो जाए, बिकॉज अभी हमने पढ़ा था कि वो एडिपोज टिश्यूज में एक एंजाइम होता है एरोमेटेज, that is also responsible for converting to your androgen to estrogen. तो आप मोटापा नहीं कम होगा तो वो जाएगा नहीं एडिपोज टिश्यू, तो आपका एरोमेटेज भी तो नहीं जाएगा ना। तो दैट इज इम्पोर्टेंट टू रिड्यूस योर वेट। और अगर आप 5-10% भी वेट रिड्यूस करती हैं, उसका फिर रेगुलर एक्सरसाइज जो भी आपका मर्जी है, जिम जाइए, जहां जाइए, लेकिन स्टार्ट सम फिजिकल एक्टिविटी जो भी है, चाहे एज पर अनूप सिंह स्टेयर क्लाइंबिंग और वॉकिंग और जो भी आपको अच्छा लगता है, लेकिन
मेरा और शशि का एक और कॉमन है, वी व्हेन वी सिट वी शेक आवर लेग्स इनवॉलंटरीली,
but that is not the exercise, sir. That is just you are burning some calorie while sitting. Do you understand? That is
just to increase the basal metabolic rate.
That is, हाँ, कितना बढ़ता है मैडम, वो कहने की बातें हैं, वो लेग से करने से BMR नहीं बढ़ेगा उससे। हाँ, उससे क्या होता है कि आपका कुछ कैलोरी बर्न जरूर हो जाता है, बट दैट इज ऑल्सो इंडिकेशन ऑफ सम योर नर्व्स प्रॉब्लम। आपके नर्व्स में कुछ प्रॉब्लम है, जैसे कि बहुत लोग सोते समय पैर हिलाते हैं ना, जिसको हम लोग रेस्टिंग लेग सिंड्रोम बोलते हैं, तो उस तरह का ये है, सिटिंग लेग सिंड्रोम कह सकते हैं आप उसको, बट दैट इज नॉट एक्सरसाइज। वुमेन जैसा बोलते हैं ना घर में, अरे भाई मैं तो घर का सारा काम करती हूँ, मुझको एक्सरसाइज करने की क्या जरूरत है? नो, इवन देन यू आर हैविंग लॉट ऑफ फैट इन योर बॉडी, तो उसको आप रिड्यूस
आपने जैसे अभी मेंशन किया ना कि हाँ ये फैट वाला जो, दैट इज आल्सो वेरी इंपॉर्टेंट पॉइंट, वी कैन डिस्कस इन सम अदर एपिसोड। शशि, यू रिमेंबर दैट वंस वी वर डिस्कसिंग अबाउट एंडोमेट्रियोसिस, that is another situation in which the women have hormonal imbalance, but that is a condition of estrogen dominance. And as Arun Kumar mentioned, there are, if a person have a lot of fat, and in because there is an enzyme called aromatase, which is, if a fat is high, there is a lot of that enzyme aromatase, that converts, we already discussed, testosterone into this androgen into estrogens. If there are high levels of aromatase, a woman may suffer from other issues like estrogen dominance.
Yeah, so that this can happen even in a relatively lean person also, provided the person is insulin resistance or some other issue. So endometriosis, I know a couple of them who are little lean. I mean, there are no excess fat, but then primarily insulin resistance hai, or insulin deficiency or whatever it is. So it does happen. Okay, that's a different topic.
Sasi,
Yeah.
what is the opposite, a different topic? When you have insulin resistance, then you increase your fat cells are increased. I mean, that is white adipose tissue increased. The more white adipose tissues, then more aromatase you have, or then it will hinder disrupt your estrogen production, and the dominance of estrogen also causing a lot of problem, which we can discuss in some other episode. That is one of the problem is your hyperplasia of uterus. I mean, जिसको आप बोलते हैं endometrium hyperplasia.
Because estrogen, तो वो जो growth hormone है ना, that is a main cause of also breast cancer in women.
Yeah. So that's why the oral contraceptives doctors are prescribing. That is I told you that it leads to cancer. That is mainly the first cancer is the breast cancer. That is why I suggest any of the women who or she is taking this contraceptive pill should stop it. Should stop it because it may lead to the breast cancer, and that's why the breast cancer cases are high in recent times, say 20 years, 30 years, because the oral contraceptive pills is used by the women very openly. I mean, it is available on the chemist shop without even prescription. So they are buying it, but they don't know that what damage causing to their body. So they should not use it at any cost. That is the cancer, breast cancer is the first and foremost target for that. Yeah, just
Yes, Anup, would you like to add something?
Yeah, not on this, but inflammation पे जब हम discussion कर रहे थे ना, so one point was missed, and it has got connection with what Shashi had mentioned in, I think, maybe first, second, or third episode of this series. Gluten is also a contributor, and Shashi had clearly mentioned get off wheat. ठीक है?
yeah.
तो एक ये है natural कि आप अगर if you are suffering, get off from wheat. So this is what I wanted to add on that inflammation as a contributor to PCOS. Rest Shashi can expand on it if he wants to.
And
Yes,
I think that's nothing much to explain on this now. We just need to get off. It can cause gut permeability. There are a lot of other issues associated with it.
Yes, dysbiosis, because अगर आपका microbiome disturb है, you have a dysbiosis, that is also one of the major cause of PCOS. So अगर आप low carb diet पे आते हैं तो automatically you have to eliminate all kind of not only the gluten, even the gluten free आटा वगैरह सब भी आपको एक बार eliminate करना होगा to really treat your insulin resistance issue. So anything else would you like to add, experts, like, or shall we go for the queries from our viewers?
Can go for queries. I mean,
Yeah,
if at all anyone wants to ask something, they can ask.
Yeah. So viewers, if you have any question, you can write in the chat box, or you can just ask directly. I think we should unmute them, or you have already done.
I have given the option that they can unmute themselves. Maybe we will not have much question on this subject.
Because I think all are male members there in our.
Yeah, all are.
So probably they will not have any question related with PCOS.
Yeah.
If they have a question, they can ask, but it only not because they are the male, because they have to face the music if somebody in their family is having PCOS. So
but still, it's not so easy to ask.
Let me, on family part, I can add to it. My nephew's wife, she was around 84 kgs of weight. Okay, she had damaged both her knees and a PCOS case, typical obesity and PCOS combined. She went on a high protein diet. Okay, high protein diet and all that, Zumba, Kumba, जो भी होता है. Her weight has dropped to 54.
From 84 to 54.
Yeah.
Okay.
And PCOS is gone.
So all the symptoms, everything gone without any medication.
Metformin, that was the only thing. I do not want to give free advertisement to one gym basically, but
yeah, sure.
She had joined that gym and the gym instructor said, get off all this crap that you are eating and switch to high protein diet.
So basically it's a low carb diet.
It is low carb only.
Yes.
It's nothing else. So don't be confused. It's just depending on your health concern, you can have high protein or low carb, high fat, moderate protein. It depends on a person to person. So please don't go to the high protein diet without consulting anybody.
Yeah, 30 kg weight loss, PCOS gone. So जो एक connection है ना दोनों में.
Yeah.
Obesity and PCOS. So I just wanted to highlight that as an family experience.
Yeah. So basically low carb will help.
Yes, any day.
No more questions.
And we can wind up then.
Yeah.
Yeah. So, Anup Singh, shall we
Yeah.
close the
Yeah,
session
yeah,
now?
sure,
There
sure,
are
sure.
some questions from the viewers' side. So, viewers, I hope that you have enjoyed our session on PCOS, and I hope that we have cleared all your doubts related with this complex issue, PCOS, polycystic ovary syndrome. So, if you have any of the symptoms that we have mentioned today in our during our discussion, go for your fasting insulin test, go for your lipid profile test, and if you see that if you are insulin resistant or if you have high levels of insulin in your blood, so adopt a healthy low carb diet under the supervision of any low carb expert, and within a few months you will see that gradually all your symptoms will go away. So thank you all the expert for all your suggestions. So thank you Anup, thank you Arun, thank you Shashi.
Thank
So,
you.
Thank you.
Thank you for inviting
Everyone.
me.
so you're welcome always. So hope we will have another discussion soon on some interesting topic. So thank you viewers for joining us.
Sure.